So question today is where does chiropractor come in the role for low back pain? So common issue coming into the office. There was a cool study I just want to go over in the sense of how they correlate, how you want to react to what should I do if I have low back pain. So first off, it goes into how low back pain progresses. This is a study they used over 5,000 people, numerous different clinics. So what they were finding is that people who had a tendency of doing absolutely nothing, a third of them actually became chronic low back pain patients. So and they defined it as 6 months. So what that means is, all right, if I have low back pain, I'll just wait it out, see what happens. What they were finding is that 6 months later, a third of these people actually still had low back pain. So one factor just addressing there is being a little bit more proactive about it versus just, I'll just see what happens. A lot of cases, it's not the best option. The other part that was an interesting one they found was that the more, they call them poor decisions that were that the patient went through during their healing process, the more likely they were to have chronic low back pain. For example, going into your doctor and getting opioids as the first line of treatment, needing getting MRI right away, or seeing a referral to a spine specialist or a surgeon in the sense of all that happened was a sprain or whatever the case may be. So these are uncomplicated low back pain patients. But it's interesting that when you start going down this path of, all right, if I go into, if I do nothing, it potentially could become chronic. If I do all these other poor decisions, like, oh, I'm just going to take a bunch of opioids and it'll go away, your chances of it becoming more of a chronic problem actually go higher and higher and higher. So in the sense of, where does chiropractic come into this, is that's one of those great opportunities for trying to address those symptoms early on. We'll try and be able to manage it before it becomes chronic, and before we have to go down that path. If necessary, sure, medication or imaging would be appropriate, but in a lot of cases it's unnecessary. And they're showing more often over and over again that if you're doing all those other steps, it actually can make it worse for just non-malignant low back pain. So unserious, it's not something that's surgical in any of this situation, and so don't address it as that. So definitely a cool perspective in the sense of, all right, if I address this effectively and appropriately, I'm going to get better faster, which should go without saying, but that's one of those things where as a chiropractor, I'm just trying to teach people what they need to know, how they can address it, and how to get better faster, so they're able to get back to what they're doing. Two, that this isn't something that just, I'm going to live with low back pain for the rest of my life, and that's just the way it is. It doesn't have to be an acceptance of defeat in that sense. But yeah, I'm Dr. Darren Howarth with Summit to Shore Chiropractic. Hopefully that answers some questions. Kind of a cool study I thought I'd share with everyone. And if you have any questions, let me know. I'll talk to you soon. Have a good day.